Today's video, we're talking about a piece of research that came out in the Pediatric Nephrology Journal, May 2023, Dietary Acid Load in Children with Chronic Kidney Disease, its association with nutritional status and health and related quality of life. So we're talking about kids that have kidney disease. And most children in America are on the standard American diet, which is a very high acid diet. Hot dogs, hamburgers, white bread, chips, soda, junk foods, fast foods, French fries. Okay, these are all things that produce a lot of acid. And the more high acid foods in the diet, as they shown in the study here, your child's going to have worse GFR, worse weight circumference, also a worse albumin. Okay, so, and this kid is going to impact and accelerate the loss of their kidney function. So what do you do? What do you do if your child has a high acid diet? Changing your child's diet is really difficult. Okay, so if you can, you want to incorporate more fruits, vegetables, alkaline foods. You can always Google a list of alkaline foods, but it's generally fruits and vegetables. Second, if you can't change the diet, but you still want to do something, you can give them a little bit of sodium bicarbonate. Okay, you can use it in a powder form or a pill form. One pill or the powder, you want to use about 1/8 of a teaspoon. It'll give you about 600 milligrams of sodium bicarbonate. Sodium bicarbonate is a super alkalizer for the kidney. We love it. You can use it in any kidney situation. Doing a little scoop in that, you'll buffer the acid, helping their kidneys for the long term. So if you have a kid with kidney disease, high acid diet, try to change it. I know that's difficult, but if not, a little bit of sodium bicarbonate is going to go a long way. Thanks for watching, everybody. Check out our other videos and to your child's best kidney health. Bye.